Lori Ascencio. Thank you, Jess. She is the community liaison. In her role, Lori is responsible for building connections within the community to improve access to and knowledge of mental health services. She believes that education is the best way to change negative societal attitudes about mental illness. Her other responsibilities include recruiting new staff and serving on various mental health and suicide prevention awareness advocacy committees. A California native, Lori has traveled extensively thanks to a decade spent working for United Airlines. Her professional background also includes leadership roles in the nonprofit sector, including the Alzheimer's Association and International Education Exchange. Today, Lori will discuss a much needed topic, compassion fatigue, and steps you can take to prevent it. I wanted to thank each of you for joining us today, and more importantly, thank each of you for the work that you do in caring for our community. Before I turn it over to Lori, real quick, I wanted to mention our Frontline Hero Recognition Program. So we are asking for nominations to help us recognize our local frontline heroes who've gone above and beyond in their care for and service during the COVID pandemic. So as we collect nominations, each week we're going to draw 3 names to be awarded a $25 gift certificate to a local restaurant. It's just a small way we're saying thank you to our frontline heroes. This program will continue through June 30th. So a frontline hero, it's not just our healthcare workers. You know, we're opening it up to anyone, not limited to, but including those who work in our healthcare facilities, emergency services, restaurants, grocery stores, daycares, teachers, nonprofit, etc. So if you believe that somebody who works on our front lines has gone above and beyond in caring for each other, please go ahead and nominate them. I'll place the link in our chat. So I will now turn it over to Lori to get started with her presentation. Thank you, Lori.
Thank you, Donna, for inviting me today. It's so nice to be here with all of you. And I guess I don't have to introduce myself because that was a wonderful introduction. And I see some familiar faces and names, which is terrific. Last night, I spoke about the same subject, compassion fatigue, with Children's Aid Society in person. And that reminded me how much I missed that. But you know, this is the next best thing, and especially since I can see some of your faces. And they had a chili cook-off. I mean, is that cool or what? So I got to enjoy that. I think we're here because many of us are experiencing the same types of stressors right now. And that's the most important point I want to leave with you is you're not alone. There is a lot of help. There's prevention, treatment. The American Psychological, I wanted to share a couple things with you. Association. Let me make sure you can still see me. They published a report in January on the status of us here in America, and their title is Burnout and Stress Are Everywhere. All-time highs across the professions, particularly among the already strained healthcare workers. And I think, you know, we fall into, a lot of us in human services fall into that type of human services. And it's exacerbated this stress by the politicization of mask wearing and other unrelenting stressors. So we're living in extraordinary times. And I'd like to begin with a mindfulness exercise because I want us to all be here in the present together. We're distracted, we have paperwork, we have our phone. So I'd like you to get as much as you can out of this experience. And I'd like to begin because so many of the tips I'm going to share with you can be classified. Take a piece of paper and a pen or pencil, and I want you to focus in on your immediate environment. And I want you to choose one of your senses. And for the sake of simplifying things, we're not going to go into some sort of complex description of how many senses we have, but we know we have our sight, we know we have our hearing, sense of taste, touch, and smell. So pick one of those. And I want you to write down 3 things that you notice with that particular sense of smell that you have right here in this moment. So pick one sense and write down 3 things you notice. Okay. So how do you feel? Do you feel any differently than you did before you were able to do that mindfulness brief exercise? Did it have an effect on you at all? Do you feel calmer? Do you feel more engaged? Or anybody want to offer a word on that? You're on mute. It always serves to calm me. I normally pick 3 from each category. And, you know, I suffer from racing thoughts as much as anyone. And that's why mindfulness for me is a constant exercise. And I look at other people and I realize when they're driving, there is no mindfulness going on whatsoever. So, you know, that's especially important. But I think in our lives right now, because there are so many external factors, if you can incorporate more mindfulness into your day, I think you will benefit. Before I delve into compassion fatigue, I just want to briefly touch on, because people ask me, well, I'm burnout. How do I know if I'm burnout? How do I know if it's compassion fatigue? What about this vicarious trauma I hear about? Vicarious trauma is sometimes referred to as it related to post-traumatic stress disorder. You have a profound shift in your worldview. You've been repeatedly exposed to traumatic experience of others in this case. You haven't experienced it firsthand, but you may develop those PTSD symptoms. You may have nightmares, you may have intrusive thoughts, trauma images popping into your head. You may startle easily. So that is vicarious trauma. Burnout is, usually takes a long period of time, and it's the physical and emotional exhaustion we feel when you're unsatisfied, you're powerless, and you feel overwhelmed, perhaps at work or in your personal life. As Donna mentioned, one of my previous roles was as director for Alzheimer's Association, and that was after my mother passed away. I was her caregiver for 9 years, and she had Alzheimer's disease. And until you've done it, it's really difficult to know what you're getting into when you sign on for it. They call it the long goodbye for a reason. It's in insurance that would be called uncapped liability. You have no idea what you're signing on for, how long it's going to be. And I did experience what we called caregiver fatigue. So I used to speak about that a lot. And there's a lot of parallels here in terms of how we feel, and with burnout. With compassion fatigue, it's a deep emotional exhaustion, and that's after repeated exposure to traumatic situations or stories. It diminishes your ability to feel empathy for others. Pardon me? Whether it's your loved ones or your clients, your coworkers. And if you're a highly empathetic person, and you hear the word empath being used now, describing someone who's highly empathetic, you're at higher risk for developing compassion fatigue because you tend to align with the traumatic situations more deeply. So you might hear someone saying they have nothing left to give, they're empty. And compassion fatigue has been described as the cost of caring. And those of us in human services are particularly vulnerable because it's our job. So we have that higher calling. It's not a friendship that we can easily walk away from or get a break. It's day after day. And the risk of compassion fatigue is it can come on very quickly. And we might not have a warning. And many of us aren't good at asking for help. So what can you do to diminish your risk? And as I said, Donna is going to be sending this handout, because compassion fatigue, if it's left untreated, it can affect your physical and your mental well-being. The two are connected. We can't have one without the other. And I often ask people, they'll tell me, oh, I just went to the dentist, or, oh, I had my wellness checkup. Unfortunately, our wellness checkups don't always include mental health, often don't. And we pay a lot of attention usually to our physical well-being, even to the point where we get our hair cut and our teeth cleaned, and we do things for ourselves. We've got our vaccinations, right, Tracy? But what attention are we paying to our mental well-being? And often until we have a crisis, we don't even recognize. And unfortunately, that's why prevention is so important to me. And I notice I can't go anywhere now. I was at the dentist with, all these drills in my mouth. And she said, you work in mental health, right? Isn't that what you told me? I said, yeah, yes, or adjacent. And she said, well, did I remember you told me you work in suicide awareness and prevention? I said, yes, that's correct. And she said, I said, I'm allowed, with the drills in my mouth. And she said, well, why is it I never hear anything about dentists? She said, we're very high on the list for suicide. And I said, that's a good point. I'll bring that up to my group because we do tend to focus in on other groups, including farmers and whereas physicians, dentists, nurses, they're very high on the list of that, and including burnout. You might not be surprised if I shared with you the highest rates of burnout, the professions is nursing, medical doctor, fast food workers. Anybody here a social worker or fall into that realm? Anybody fall into that category? Okay, well, Tracy falls into several categories, right, Tracy? When I was with the airlines, air traffic controller, that they're still on the list of police officers and emergency response. I understand emergency veterinarians are very high on the burnout list. Lawyers, teachers, and CPAs. So that's the burnout list, and that's pretty consistent every year. I wanted to share the lowest, in case you're considering a career change down the road, the 5 lowest burnout professions or jobs. Some may surprise you. The first is hairstylist. And we know we need them desperately. We found that out at the beginning of the pandemic, right? Jewelers. Might not think about being a jeweler, but it would be interesting work. Biomed engineers. And then geoscientists, they say being in nature is really healthy for us and they get to be outdoors a lot. And lastly, dog walker, something we're all qualified, or most of us, to do. So if you're thinking of a career change, those are possibilities. I want you to consider the ways that you can live more emotionally healthy, mentally healthy, are also ways that will help you prevent compassion fatigue. And we're going to share 10 tips with you. The first is education. So kudos, congratulations that you're here today. I bet a lot of you have read. Can I see a show of hands from the people read about compassion fatigue, read about these? That's great. That's the first step. The chronic exhaustion. And this type of exhaustion from compassion fatigue, it doesn't get better because you go away for the weekend or you take a week's vacation. Unfortunately, it lingers. It's there for you when you return to work. You might have headaches, trouble sleeping. You might, weight loss. I don't know. I think it's the opposite one, to be perfectly honest, but maybe your decision making is impaired. Your personal relationships. And for many of us, we go home and we may have additional challenges and responsibilities at home. We may have a special needs child. We may be a caregiver of a parent. I know that has been my role often in life. Secondly, beyond education, beyond knowledge, would be to practice self-care. So what does that mean? What does that mean? It's something a little bit different to everyone. I would say that for some people, turning off their technology and going to bed an hour earlier might help. For other people, it's remembering to practice mindfulness. And there's so many wonderful mindfulness exercises on YouTube to help you just, if you're living in the future, this is something I've had to learn. That's anxiety. And if we're living in the present, we can enjoy our lives. The parts that are enjoyable. All of life, unfortunately, is not. So self-care also includes balancing your work and your personal life, taking time for your emotional needs, exercise, a good diet. Everybody knows about the Mediterranean diet. You know, I think when I used to talk about that years ago at Alzheimer's, they would all raise their hand and say, yes, red wine. Somehow that was the one part of the diet that everybody remembered, which actually isn't even on the diet, is it, Tracy? I don't think anymore. They don't even list it there, do they? But I have family in Italy, and I would say, and Spain, I think I can point out other things, characteristics, lifestyle, attitudes. You know, I was always told, you know, you Americans live to work. We work to live. Another comment in my travels, I would be asked, and I used to be always underweight, right? And the people say, not you, but why are Americans so fat? And this was a long time ago. And I really had to think about it. And I said, you know, I guess I would go places and people would be walking, people would be riding bikes. And I realized that, you know, we're headed for some real challenges in this country. And I got that perspective from traveling. And sometimes it's really beneficial, just like it is in your personal life. If you talk to someone that you know and trust, does everyone have at least one person that they can talk to and really let their hair down? That's so important. Listen to what they have to say about you. You know, you're looking really tired lately. I've just noticed an irritability in you. You seem unhappy. I'm worried about you. Take that to heart, because that person cares about you. So getting educated, practicing self-care. Third is emotional boundaries. You want to remain compassionate and empathetic and supportive, but you can't get overly involved. We've all learned that, and take on that person's pain. Setting emotional boundaries can help you maintain a connection while still remembering and honoring the fact that you are a separate person with your own needs. I think this is one of the hardest parts for me as an empathetic person. And that can be so overwhelming in life when there's so many people that need. And those of us that are giving people, we may attract those people in our lives, in our personal life, as well as at work. And before we know it, we're overwhelmed and we don't have a way to renew ourselves. It brings me to engaging in outside hobbies. Has anyone heard the term your flow state? It's a yoga term that gets thrown around. It's your state of bliss, something that you do that's so enjoyable to you that you're completely immersed in it. You have no sense of the outside world, the passage of time. It's something you have some skill at, but it is something that is, you know, could be called your flow state. I call it my bliss. For me, it's painting. I'm a watercolor painter. I haven't been doing much of it lately, I can tell you. And I really don't know how much time has passed. And I find myself, the break is just so healthy for me when I do that afterwards. I just find my brain has been cleared of so much noise that's going on in there. On that piece of paper, you wrote down your senses that you noticed. Write down one thing, just one thing. It might be reading, it might be walking in nature, it could be playing an instrument. Is there one thing that if you chose to do it, if you had your choice, where you would spend your time, it would be that? If you don't have anything that gives you that feeling, I bet there's something you're interested in that you'd like to explore, perhaps a class you've been wanting to take. My husband doesn't know this, but I signed him up for ballroom dancing later on in the month. I went to a chamber meeting at the Tada dance studio, and I told him, I said, my husband and I took ballroom dance before we got married because we were thinking, you know, we're going to dance and we don't want to make total fools of ourselves. He tells me it was with another boyfriend I did that. Okay. He has no memory whatsoever. Every time we go somewhere and there's dancing, he reminds me, that wasn't me, that was somebody else. And I said, I wish I had a picture of that if we had cell phones back then. And they're going to start us off with tango. Wait till he hears that. So I haven't broke it to him yet. Maybe tonight if he's in a good mood. But the point is that you have some really fun things, and it can be something so simple. Pets are really great, right? Pets are very therapeutic. Fifth is you cultivate healthy friendships outside of work. Work friends are great. I used to tell my staff, you don't have to be best friends. It's great if you develop a friendship, you get along, you need to be professional. You need to be kind and courteous to one another and treat each other well, but you don't have to see each other outside of work. If that happens, great. But the great thing about friends outside of work is, what do you do when you're with your friends from work? You just talk about work, right? So friends that are involved in something totally different, how refreshing is that? I have a group of artist friends, and they come from all backgrounds, and most of them are quite a bit older than I am and have had such interesting lives. And I love being with them because they'll say to me, Lori, we keep asking you what you do. What is it you do again? And nobody asked me for mental health advice or dementia. That was the one, because I'd walk around and people would say, oh, it's a dementia lady. And I'd be like, I'm not sure that's a complimentary title, but whatever. What I like about mental health is I like the fact if people will talk to me, it opens a conversation on a topic that was previously so hidden. And when I first got involved in the suicide prevention networks I'm in, I honestly had to think about it in terms of my own life and family. And I realized, I have been touched. I do have family that have did die by suicide. You're not supposed to say committed suicide. I'm learning a new language. And I thought, I still have family who say no, who are in denial about them. And I realize how far we've come to be able to have these conversations. And like today, be able to talk about compassion fatigue, because when I was first in the workforce, we didn't complain. We didn't talk about burnout or being tired unless we were really in a safe group, because we were seen as complainers or weak. There was no sense that, my staff needs renewing, my staff needs help. So I hope that things are changing and have changed in so many ways. So if you're only having time with friends who from work, cultivate some friendships outside of work. Journaling. How many people here journal? You can put your hand. Do we have a hand that we can raise? Oh, we don't have a hand. Okay. I hope that some of you journal. And yesterday, one person raised their hand in the group I was speaking to, and she said, I keep a journal every morning. Every morning I write down what are my goals for the day. And then at the end of the day, I go over those goals. And it's not to judge myself, but I can pat myself on the back if I've completed at least one of those. And I just started laughing because I thought, it doesn't sound like a journal to me. And it kind of sounds like a to-do list, it kind of sounds like a checklist, but I'm not, okay, if you want to call that a journal. I said, the kind of journal I'm thinking of is something that's fills you back up. So many people go to sleep at night, right? And prior to that, they make a gratitude list. And that's great. I think it's in the morning, it's a good time to keep that book out or that list out and just write down something positive you notice in your environment. It might be that delicious cup of coffee you're having. It might be a perfectly ripe banana in your cereal. It might be that hot shower that you took this morning, but it's something positive to start your day off that way. And then just add to it if you can. If you're working from home like I am, people will say such nice things to me sometimes, and I'll just write it down so that I remember, because I have all these little slips around, and so many of them revolve around reminders. They're not necessarily a happy thought. So that journal helps me just focus in on the positives in my life. Number 7 is boost your resiliency. That's our ability to bounce back from stress. And some people are more naturally resilient than others. They just seem to have, I know I always tell one of my sisters and my husband, they have a sunny personality. They wake up in a good mood. They're so blessed that way. I wake up and my husband grinds the coffee, espresso beans. Everyone's a good little Italian husband. He grinds the beans and he's making the espresso, and then he'll foam my milk. And I know my latte is going to be out there somewhere. So I get myself up and do what I need to do, and then eventually make it to the kitchen. And there's my latte waiting for me. And I just take a deep sigh, and I enjoy that so much. I never liked coffee, but I don't know what it is. It's just the whole process. And it gives me a little caffeine boost, and I connect with my husband, and I'm appreciative and grateful for him for doing that for me. And it gets me going for the day. That helps my resiliency. Having a good night's sleep really helps me. But maybe you need some coping mechanisms too, whether it's taking a break. You know, how many of you sit at your desk and aren't that great at taking breaks? Can you, if you work with other people, if you're going to an office, maybe you can have a buddy system and help each other. Come on, you know, it's been 2 hours. We're going to get up and stretch our legs. We're going to go get some water. Something I've started doing, which is a very simple habit I've developed. And every year we put on a recovery conference with one of my groups. And the doctor who came and spoke to us said, you know, this is kind of like the sunscreen speech, if you've ever heard of that. You know, we think life is so complicated. But she said, do one thing for yourself every day. Drink a glass of water first thing in the morning when you get up. I know you're going to have coffee or you're going to have whatever you do. Just drink a glass of water. Start your day with that. Try something different. Make it a habit every day. And you know, I started doing that and it made a difference. It's amazing to say, because I consider myself a water drinker. You know, I drink a lot of water, but for some reason that morning water just makes me feel better. Like I said, coping strategies can also incorporate some of these other suggestions that I made to you, like the self-care that you need to do. Number 9 is identifying workplace strategies. So what does that mean? Well, it might mean making suggestions to your employer about, you know, what can we do to help prevent compassion fatigue? What kind of breaks can we take? This group I met with last night, they have this annual meeting and they have a chili cook-off, like I mentioned, cook-off, and they won prizes, the first 3 or 4 people. And what a great, there were some new staff there. What a great icebreaker. People had a ball. It was amazing. And a couple of women brought their babies, and it was just a great opportunity, a very low cost opportunity for an employer to have not only team building, but give people an opportunity, and then to have, I hope I help them, to have someone talk to them about self-care, about compassion fatigue, about ways to take better care of themselves. So having open discussions in your workplace, and maybe having a support group, you know, yes, we have meetings, but is that directed towards dealing with feelings of being overwhelmed and potentially the risks we all have at compassion fatigue? Have a way, like I said, a buddy system to check in on coworkers. Mental health days, you know, it's just as important as a personal day to run around and do a million errands or doctor appointments. Some workplaces are even having on-site counseling, They have relaxation rooms, massage, meditation classes. I'm from the West Coast, and it's amazing what some of the tech companies have. People that I know that write me, and they have acupuncture available, they have massages available, they have all their amazing cafeterias, you know, with chefs and vegan food, and they'll have life coaches. And, you know, sometimes we work on a much smaller scale, but we can do some of it. And lastly, personal therapy, seeking that. It's not to be afraid to ask for help. I share this. At first, it was kind of awkward for me because I thought, ooh, you know, this seems kind of personal, but I started telehealth. You know, when we started that pandemic and we went to telehealth, that was one of my responsibilities, was try to get people connected with that. And I had heard for so long, you know, one of our biggest challenges we have in this area, we have lots of services, but it's getting people to the services, right? Making those connections. And so transportation is always on the top of the list. And you would think that would be not something that we would have to be addressing all the time, and it's never really resolved. There's some resources now, but you know, they waived the copay, and I said, I have no reason now. There's no barrier to my going and speaking to a counselor for the first time in my life. I don't think any of us makes it through life without difficulties. I can't see. I suppose maybe someone in a coma, I don't know. How would you not have difficulties throughout life? Some kind of challenges. And I really benefited from it. I really benefited. It was very difficult for me. I had a hard time. I'm accustomed to listening to other people and their problems. And I learned some really important information about myself, including words that I need to remove from my vocabulary, like should. See, I was just about to say should. And the therapist always saying, you just use should again. You should have done this. You should have done that. You know, that's judgment. So that's not mindfulness. It's very difficult not to be hard on ourselves, I think. But what a therapist can do for you is give you not only that sounding board, but therapists work a lot differently today than they used to. A lot of it's about skill building. You have those skills, but you need some help developing them. So that is my last tip there. And you're going to receive this handout. Remember, it's not selfish to love yourself, to take care of yourself, and to make your happiness a priority. It is necessary. I'm going to share a worksheet with you when you get your copy of my handout. And that worksheet is for you just to use and keep handy to set reminders for yourself. And the first part is, I want you to identify the habits you don't regularly practice. Okay, so those will be areas you want to pay attention to. And I think for many of us, do we eat a balanced diet? Well, I try, but sometimes no. What's our exercise? Oh my gosh, the treadmill broke. Everything broke during the COVID. There wasn't almost one thing that didn't break. I don't know what that was. So we finally got it hauled out of here. My husband said, do you want another treadmill? I said, no. I mean, the thing was a behemoth. It took up half of the room. I said, no, we got to go some other way. So we have to figure that out. Now we got all this weather, so it's difficult for people to get out, right? Consistent sleep schedule. How many people here are good sleepers? If you even do get to sleep or have a consistent schedule, we know it's important for children. Well, it's important for adults too. Building that strong work-life balance and recognizing your emotional needs. So this worksheet, I hope, will help you and be on, you have to be honest with yourself. Do you regularly take breaks? I've had to set timers for myself. So in 2 hours, I get up away from the computer and I stretch and I go drink a glass of water. I go do something else. So in terms of setting boundaries, years ago, I attended a workshop on dealing with difficult people. And it was very helpful to me. Was never a good person at saying no. I'm embarrassed to say what I would do, but people would ask me if I would do something for them, right? And I would have something scheduled for myself, let's say, as an example. And I'd start talking and I'd end up in a circle back to saying yes, when I meant to say either no, or I'm not sure I can do that. So for example, someone would ask me, if I could cover for them, maybe trade schedules with them, something. And I would start by saying, well, I really can't because I made an appointment and well, it's just a haircut. It's just a hair appointment. So, I guess I could reschedule that. So sure, I can do it. Because I felt pressured to answer right on the spot. And of course, I wanted to help that person. But what did I end up doing? I ended up doing something I didn't really want to do. So what I learned in this workshop about dealing with difficult people was there are responses I can give that are kind and truthful. Because I always tell my grandkids, always be truthful, but it doesn't mean you have to say everything you're thinking, but be truthful in your response. So that what I learned to say was, let me think about it. And that gave me an opportunity to either really decide, is this something I want to do or not? And think about how I want to respond to this person. Something else you can say is, here's what will work for me. Okay. I just was recently asked to do a 4-part series. And a lot of the work I do is on my own time. So when it comes to outreach or education, so I said, I thought to myself, I can't possibly commit to that. I try to do 1 a month, maybe 2 a month. So I figure I get between 12 and 20 per year education type presentations. And I had to think about it. And that's what I said, I'm going to have to think about it. 4 is too much of a commitment with everything else I have going on. But I'll come up with some ideas. And so I did. And at this point in life, can I get back to you? Do you feel comfortable saying that to someone? Donna, anybody out there, do you feel comfortable? Someone asks you, even your boss, even your supervisor. How about that doesn't work for me? That's a hard one for me. Unless I'm out of town. I'm going to have surgery. I have to have a pretty good reason to be able to say that. And a 5th one is, I wish I could, which is probably not always truthful. I don't know that I wish. Can you watch my kids for the weekend? My 4 teenagers. Well, so I'd really like to find out if anybody would like to share anything that they do that they find helps them prevent compassion fatigue. Is there something that you do in your life that you feel is really helping you guard against that?
I'll go ahead and turn off the recording.
Oh, cuddling with my dog. I like that, Dr. Guerrero. Thank you. I've enjoyed your talk so much as benefit. I share your information with everybody.